So I want to make a video about my treatment of SIBO as part of the bigger picture in my health. So my last video was about my immediate acute treatment for small intestine bacterial overgrowth, and part of that follow-up is to address the root cause. So there's several contributing factors related to SIBO, which I'm not going to talk all about here. But one known contributor for me is co-infections. So what does that mean? It refers to other types of infections: bacterial, viral, fungal, protozoans. These are all possibly contributing to the recurrence of SIBO. So for me, I have had a long history of symptoms related to my neurological system. So when I first became sick in 2006, I was 23. And I had been teaching abroad at the time. I was doing a certificate course, and I started to feel really dizzy, and along with that was a sensation of weakness in my knees. I was also really anxious at the time and was extremely fatigued, so it was just hard for me to go about doing my day-to-day activities. So I went to the doctor, and it became pretty clear to us within a few weeks that I was potentially suffering from Lyme disease. And we didn't know where I had exactly, or when I had exactly contracted that infection, but it was also possible that there were other infections that were tick-borne as well that we weren't able to easily identify. So I went through many years of hell trying to get and confirm this diagnosis, and what I actually found was a lot of misinformation, and I found that I was bumped around from specialist to specialist, investigating each one of my symptoms without ever really trying to figure out what was going on. So in my process of trying to understand my own health, I came to the treatment of naturopathic doctors and doctors of Chinese medicine, as well as acupuncturists, as well as counselors and therapists and other people on my team who have helped me to feel better. I've done a lot of testing, and in my most recent round of testing, in finding out about the recurrence with SIBO, we decided that the best course of treatment was to do the antibiotics and then at least 3 months of Chinese and Western herbal medicine. So the whole purpose of this was to not only kill off some of the overgrowth of the bacteria and hopefully the pathogenic bacteria, but also to calm the inflammation. We had known that this was in my nervous system. I was severely depressed and extremely anxious to the point of panic all the time, and that makes it really difficult to live. So this is what my first 2 months have been like. So first, of course, was the antibiotics. I felt less gas and bloating almost immediately since I started it. At the time, I was having a lot of belching and a lot of upper GI symptoms, so like reflux that was feeling almost like palpitations in my heart. And I was having the sensation, you know, when like there's like a deep-seated like fear or panic, like something's like really, really wrong, and you feel that in the pit of your stomach. I was feeling that all the time. Like it just never went away. And so when I first started taking the antibiotics, this time I felt that go away for the first time in years. Um, After that, I started having a lot of burning and soreness. So it was like a dull ache in my gut. And it sort of just stayed there and maybe even got a little bit worse over the 2 weeks of the antibiotics. I also noticed that by the end of the 2 weeks, I was really, my legs were really sore and really tired, and I basically spent most of those 2 weeks laying in bed, even though I had tried to move around a little bit. It just felt too sore and uncomfortable in my belly, and my legs hurt a lot. So after that was the beginning of the herbs, and what I did was I had a batch, two types of two different Chinese herbal formulas, and I alternated 1 week on one, and then 1 week on the other, and then back to the first one, and then back to the second one again. And the first week I had a lot of pain in my stomach again. I felt like the SIBO was coming right back. I was eating a varied diet at that point, so it was still an anti-inflammatory diet, but it was it wasn't going down very well. Like I had started to lose my appetite again, and I could tell that the SIBO was coming back, but then at the same time I sort of felt like there was this burning that didn't quite go away. It was sort of there all the time, and I spent a lot of the time in bed with castor oil on my stomach and a heating pad. And then I moved on to the second week, and the second week's set of herbs really knocked me out. I felt like my migraines were back permanently for at least that whole week. I was having almost like a shortness of breath, and I was feeling really, really tired. Like I couldn't distinguish between my headache and wanting to close my eyes while also wanting to cry. And so for that whole week, I pretty much tried to sleep through it as much as I could. The third week, I went back to the first herbs, and again, it seemed to be focused more on my gut. I was having more gut symptoms, and the headaches kind of cleared a little bit. I definitely noticed that when I was having symptoms, they were passing more quickly. So, for example, before I had started doing this treatment at all, one of my symptoms was soreness and stiffness in my neck. And what went along that was like cystic eruptions. So I would feel like I would have like, it wasn't quite acne, it was like legitimate cysts that were really painful to touch, and I would get them in the back of like my head here and behind my ears, and they would go and like where my cervical glands are here and under here, and then it would take a really long time for them to heal. So it wouldn't just be like a normal pimple that would like erupt and then go away. It would just be really swollen and red, and it would just take like 2 or 3 weeks like to come out, which is really long. So when I first started the Chinese herbs in that first month, I noticed that I was erupting a lot through my skin. My skin was breaking out, but it was passing through more quickly. It was coming through to the surface of the skin, and it wasn't like quite as swollen and sore as it had been in the past. And so now I'm on the second week and my skin is cleared up, and I've had one bump that showed up here this week that's a little bit painful, but for the most part, like, I'm not having the stiffness as much in my neck, and the cysts have gone away. So that's good. Let's see. So my migraines, yeah, they kind of alternate with the herbs. I feel like sometimes more of my symptoms are more in my gut, and related to the gut is the sensation of anxiety, and but it's more of like a terror almost. It's like a panic, like something's gonna go wrong and I'm not gonna be able to handle it because I'm too sick or I can't move around a lot, and it's scary. It's really emotional. I feel a lot of my neurological symptoms emotionally, and that's really hard to deal with because in between I'm able to have the clarity to know that this is separate from me and it's not me that feels this bad. In fact, I want to feel good, but there is this inflammation and these alarms going off in my nervous system saying that something's really, really wrong and we need to do something about it. But it's been hard to find a treatment. So the fact that in the first month I've been able to see a shift in the not only the physical and the body pains, but to also see some changes in my mental and emotional health. That's been a really big deal because it's hard to live for so long being so sick. Like, I first got sick when I was 23, and I'm 35 now, and I've lost a lot of relationships. I've missed out on a lot of events and opportunities in my life because I've been too tired or fatigued or dizzy or anxious to be able to do those things. And I got to the point where it was really hard to live. I mean, I honestly don't even know how I made it 12 years without like a proper, consistent treatment. So I'm really thankful that this is something that I've come across and learned about, and that I have a team of knowledgeable people around me to support me and say, listen, it's going to be rough getting through these first few stages, these first few months, but after that, you should be able to expect to feel better. So I'm going to leave that at that for now. I am rearing out the end of the second month, so I want to talk more about that, but I'll do that in another video. So thanks for listening. Bye.